Hey y'all, I'm Dr. Megan Faulkner with Apex Sports Medicine, and today I'm going to be showing you a video on how I like to use the Ttool to work through the upper trap fibers. The fibers of this muscle are really thin up towards their origin point in the cervical spine, and then they get a little bit more dense in the muscle belly in between the neck and the shoulder, and then they get thin again as they insert onto the shoulder, the clavicle and the spine of the scapula. So what I'm going to do is show you how I scan through the muscle for any knots or scar tissue, and then I'm going to show you how I treat each of the areas. So first, I like to scan by placing the long, thin edge into my palm, gripping, and I get to use this round edge to press into the muscle belly, and because it's so blunt, I get to press in a little bit further. The skin sensation is less because we don't have quite such a sharp edge on this tool, and I'm able to kind of feel some of the deeper layers of this muscle. Another added benefit with the Ttool is that I can scan over clothing, so for the comfort of the patient. So here we're going to scan through the musculature here. I'm just going to start by pressing firmly into the tissue and glide down the length of this upper trap fibers and search for any bumps or lumps in the tissue. And once I find something right here, then I can go ahead and start treating. So I'm going to start with the muscle belly, and I'm going to work the tissue over the knot that I just found in more of like a massage type of fashion. So I'm going to glide over this tissue. And then what I can also do, and what's great again, is because we don't have such a sharp edge, this tool is designed to treat through the clothing. So I can actually provide therapeutic benefits over clothing into this musculature. So the next thing that the next technique I like to use is we're scanning and we're going to find that same bump or knot in the tissue. And then I'm going to do a pin and stretch style treatment to this tissue. And what's great is that because I can feel what's going on in the muscle with the tool, I don't have to press with my thumb. So it is a thumb or hand saving device as well. So searching, I'm going to find that knot. I'm going to press down on the knot and pin that in place. I'm going to have the patient bring his head towards the tool or towards the muscle, shortening that tissue. I'm going to press down here. Again, I can use the whole weight of my arm and my shoulder, and I don't have to use my thumb for this. So I'm going to press down gently, and I'm going to have him bring his head away from the muscle, lengthening that tissue for the stretch part of that pin and stretch. Good. So that's in the meaty area of the upper trap. Then what I want to do is I'm going to grab the round part of the tool and treat with the thinner edge here and these kind of more delicate upper trap fibers closer to the cervical spine. So I'm going to set my patient up, looking away and then dropping down just a little bit to expose a little bit more of this tissue. I'm going to use the weight of this, so I don't have to apply any pressure. This tool is weighted enough to where I can place on the fibers that I want to be working on and allow the weight of gravity and this tool to glide down this tissue for a nice, comfortable, but firm contact. And I can also grip here. So there's many places you can grip. I'm just using a couple of fingers here and pressing into the tissue. I don't need a lot of pressure in this area. I can also grip the rounded part and glide through here. Good. And if we're moving towards, you can look straight now, if we're moving towards where it inserts onto the shoulder, same kind of thing applies. I'm going to hold on to this rounded edge. Because this is nice and narrow, it will fit right here in this kind of triangle that the clavicle and the spine of the scapula make. And I'm going to treat down into these more delicate tissues using the soft edge, the smaller edge of the Ttool. Again, I can grip this way as well and work in more of a massage type of stroke through this tissue. So that's how I like to use the Ttool for the upper trap fibers. I hope you enjoyed.